everybody, welcome back to Dr. Winnie King's podcast. You know, we talk about a lot of interesting things on this show, but today we're going to talk about intimacy issues from the male perspective. You know, women talk about sex all the time, you know, wants your girlfriend, you know, we talk about this, we want that, he doesn't do this, he doesn't do that. But we're going to have this perspective discussed from the male perspective. And so I'm joined by two very handsome young men that are obviously in their prime and life is good. And so I want to get into this discussion with them from the male perspective. I mean, I've been in a physician for a long time and I've talked to a lot of men, but you never really know, as a woman, how men feel about things unless you ask them. And often as women, we don't ask, we just make a lot of assumptions and then we just sort of go from there. So I'm joined by Laz and by Callie. Thank you guys so much for being here. Can you just give us just a little brief synopsis of your history, your background? I know you're both personal trainers, obviously, but tell us a little bit about you.
My name is Laz, or Lazarus. I am a personal trainer, professional bodybuilder as well. Been a personal trainer for about 6-7 years, bodybuilder just as long. Run, manage, and own gyms as well. And so yeah, I mean, I've basically been an athlete most of my life. Did track and field at U of H. Also have a Bachelor of Arts in Mathematics from U of H as well. And yeah, I just been around fitness most of my life.
Really? Well, you got a great name, Lazarus, because that means as a bodybuilder, you bring people back from the dead.
I keep them from the dead. Keep them from the dead.
That's right, we're trying to keep them alive.
Yeah.
Great name for what you do. So Callie, tell us about you.
My name is Kelly. I'm from California originally. I've been personal training for about 10 years now. I've been here, Houston, probably about as long as I've been personal training. Also sports background, played basketball, baseball, football, ran track as well. I'm just into fitness. I guess what got me into fitness was not really having a place to go, something to do. So I kind of needed somewhere to kind of channel my energy. So I ended up going to the gym, and then from there, looking around at the guys walking around being trainers, I was like, I could do that.
Yeah.
So I ended up talking to another friend of mine who was a personal trainer for the NFL, and he gave me some of the great advice that I've ever had, and I've been using it ever since. And he was just like, man, get you a certification and always be learning.
Yeah.
So once he told me that, I kind of took that to heart. Here I am today.
Well, I would imagine that both of you guys probably have a lot of folks that come to you for help with weight loss and with tightening up, building muscle, and that's why I think it's really helpful to talk with you all, because what I do in my practice is sexual rejuvenation. You know, I do that for men as well as for women. And often I'm helping, let's talk about men for this particular discussion, that are in trouble. They're behind the 8 ball. You know, they've gained 50, 60 pounds, you know, they feel lousy. The doctor may have told them, man, your blood pressure's too high, your cholesterol's too high, your blood sugar's too high, you're a dead man walking. And you need to get it together. And he already knows that something's not right because, you know, Mr. Happy ain't been happy for a long time, you know, and Mrs. is looking at him all crazy, like, what is wrong with you? And so he's feeling horrible. He doesn't have much energy because, you know, as you age, you lose your muscle mass, and so your metabolism goes down and you just kind of feel sluggish. You want to do better, but you can't even get out of bed to do better because you just feel so tired.
Yeah.
You know, what do you do to motivate men when they come in and they say, I need help? How do you help them? What do you do?
You know, it's as long as I've been a trainer, it's been different approaches with men. Ladies is a different story, but with men it's been different approaches.
Yeah.
I think the very first approach I approach with is I let them know, drop the pride.
Yes,
Drop the pride. You're here for a reason. If you did know everything, then you would fix it. And you just have to drop the pride and kind of trust the process.
Yeah.
And if that goes, then everything kind of follows with men. Because once the pride is gone and you're not so ego, you know, you're using your ego to maneuver through a program, or I got this, or especially, you know, oh, my body can take this, and you know, I can eat whatever. If the pride is gone, then everything else just kind of works. It's a domino effect. And then men, you know, we tend to get results quicker. And so if they drop the pride, man, the ball is rolling at that point. And other approaches is if they're there for medical reasons. Like at that point, there's no pride. Like you said, you're about to die. You know, I'm trying to save your life. So it don't even matter if your pride is here or not. You're here because on a doctor recommendation. You're here because we stepped on the scale and your body fat is well over 50, 60, and so at that point, there's no pride. I'm literally telling them like, hey man, like this is serious at this point.
So how do you help them when we have something like that dead man walking type presentation? How do you make sure that you're not doing too much? That you're helping them to like get where they want to go without pushing them too hard.
Yeah. Well, first we start with the diet, and so the diet is going to be the very first thing to kind of start with. Fixing your diet can fix a lot of stuff with your mood, a lot of stuff with just your body in itself. And so I let them know anybody can come in here and lift weights and push this and push that. But the hard part, the work, the magic goes on in the kitchen.
Yeah.
So
I'm so glad you said that because a lot of guys, I've seen men get a diagnosis, or they've been told, oh, you have high blood pressure, you got diabetes, we got to get this right, and they go and get a pair of sneakers and they start running around the neighborhood, and you look out the window and you see them go by, and then the next day you go by, and then by day 3 they stop because you can't maintain it. You know what I mean? It's like they run out of fear. And they don't know how to just settle down and get some professional help. Now, how does someone know that you're the one they need to go to? How do you distinguish between somebody, you guys are obviously good at what you do, and people out there, because there's a lot of people out there saying they're trainers, some of them got guts bigger than you,
and so that's the answer, I feel like how do they know is that take a look. Take a look. If you walk through our gym at Space City, just take a look at our trainers.
And tell me the name of your gym.
Space City Gym.
Space City Gym. Okay, all right. And that's located in downtown Houston.
Humble area.
Humble area.
Okay.
All right. So everybody there is trained. Everybody there knows what they're doing. You don't have anybody out there offering help that's not qualified.
No, not at all. Not at all. And like I said, if someone comes in, how do you know I'm going to get my results here? First, take a look at our trainers. Second, we have like a transformation wall. And so you can walk down this like Hall of Fame kind of deal. These are the members and clients who've lost 10, 20, I think it's 50 and then 75. We have members that's lost 100 pounds. And so results based. And so we're results based.
That's good because when you get where you're in a space where you want to do something, you're desperate, you're vulnerable. And so you can easily get suckered into something that's not really right for you. And that's why I want my viewers to understand that you want to go someplace that has professional trainers that know what they're doing. If they're sitting there eating a burrito and they've got his hanging up over there, done lapped over, as they say over there, that's probably not the one. It's probably not the one. Or your cousin's brother, who's never really been trained. You want to make sure that you're going to somebody who is really, really good. What has been the biggest win that you've had with a client?
I had a couple of them. One client was actually a quadriplegic that I was training, and to get her to actually get up out the wheelchair and start using her crutches, that was probably one of my biggest ones. Next to that, I've had a client literally drop almost 200 pounds.
Really?
And just from trusting the process, eating the meals, coming in, trusting me enough to allow me to tell her what to do, you know what I'm saying, and see her make that change and stuff. So it was great.
200 pounds, that's amazing. That's really amazing. How about you guys?
I think for me, it's been mostly transformations. I've had a client lose about 100 pounds with transformation. I think different, trainers have different, what am I trying to say, like different clientele kind of deal. And so the results part, like the numbers parts, but sometimes changing the lifestyle is a result in itself. I've had a client that would drink a 40 every day. After work at 3 p.m., that's what he's doing. And I've changed his life on that standpoint. And yeah, I think he lost, what, 60 pounds?
Yeah.
So
Listen, 5 pounds is impressive. You
Yeah.
know what I mean? I've got a 5-pound fat model in my office, and I
Mhm.
show people, listen, if you can drop 5 pounds of fat, you've done something.
Yeah,
You know,
yeah.
metabolically, you've done something, and also just in terms of your aesthetic
Mhm.
appearance,
Mhm.
which is really what drives most people is, you know, the way they look.
Yeah, and I think as a trainer, like your walk in fitness
Yeah.
too will kind of like attract your clientele.
Well, you know, you guys are talking about diet and exercise, which is what I, as a wellness doctor, talk about with my patients all the time, and they just look at me and they roll their eyes because they don't understand that the two are linked. You know,
Mhm.
you can't just work out but then not modify your intake of calories.
Mhm.
You know, you can't just modify your intake of calories and not get some form of physical exercise. I mean, you don't have to, you know, be running marathons, but you
Yeah.
need to do something.
Yeah.
Now, you guys are able to give advice about dietary changes as well as exercise?
Mhm.
Okay,
Yeah.
and I think that's important because the two of them are together.
Mhm.
You know, in my practice, I do GLP-1 medications for patients that are trying to lose weight. It's so all the rage now, everybody wants it. But what I tell patients is that that's just a quick fix.
Mhm.
And the moment that you stop those medications, you're going to gain that weight back, if not more, unless something has happened
Yeah.
in your life. Now's the time. You're dropping the weight, 2 pounds a week, you know, half pound here and there. But now's the time for lifestyle modifications
Mhm.
because at some point you got to cut off that medication. You can't live on that for the rest
Yeah.
of your life. And what typically happens is the yo-yo dieting that people experience, and then they come back and they're, you know, as big, if not bigger than they were when they started. You know, now my goal of doing anything in the weight loss realm is to give people control over their lives and not to make a whole bunch of money off of them. Because you can definitely make a whole bunch of money because again, you're taking advantage of people's desperation.
Mhm.
Unless you truly care about making them well. You know, as an old ER physician, I practiced emergency medicine for nearly 30 years, as many of you guys know. I've been there on the worst day of people's lives, when they've had a heart attack or a stroke, and or I got to tell them they've got cancer, and you know, I just look at them like, who's your doctor? You know, I mean, that's what sort of got me into wellness. You know, out of all when I left the ER, I'm like, somebody's got to help these people.
Mhm.
You know, you're diabetic, you're walking around with an A1C of 8. You know, my God, we've got to do something.
Mhm.
And just giving you pills or giving you shots is not the solution. So that's why this is important to me. I mean, we're going to talk about the sexual rejuvenation because that's important too. And I know for men, that is like everything. And that's only because, oh yeah, you're done, oh yeah. You know, and that's only because for men, their sexual potency is tied into their self-esteem.
Mhm.
And so when they're not able to perform, they feel a certain kind of way about themselves. And that sort of comes out in several ways. They either become depressed, you know, withdrawn, angry, moody, irritable, because they don't feel like themselves, you know, and they know back in the day what they could do, you know.
Yeah,
The
yeah.
wind would blow down, you know, Mr. Happy would be up, and now, you know, you could have a tornado. Nothing's happening. And they're just like, hey, God, you know, and so in my practice, what we do is a lot of sexual rejuvenation, where we're helping men who are having trouble, achieving an erection and having sex, with various things that really help to promote blood flow. Because that's what an erection is, it's blood flow. I mean, if you have no blood flow, you ain't got nothing happening. I mean, that's just the way it works.
Mhm.
But the psychological part is what is the thing that keeps guys from coming in. They're embarrassed. They don't want to talk about it. You know, they're ashamed. And it's usually the wife that will call me and say, listen, okay.
So like, my wife will call you.
You know,
I didn't even know here.
So wrong, big day.
Exactly. Listen, big ain't so big no more. And I'm really getting ready to find a little side piece. You know what I'm saying? You know, like, no. Wait, before we go there. And that's not only women saying that, that's men saying that as well, you know, that their wives are having trouble. But we're just talking about male potency on this particular podcast. But it's so important to understand that when a guy, from my perspective as a physician and as an ER physician, when a man has problems with an erection, where he's not able to achieve an erection, for me, the first thing that is potential heart disease. Because blood flow is everywhere, you know? It goes to your heart, it goes to your eyes, it goes to your lungs, it goes to your penis. And so if you're not able to achieve an erection, that means that there's something interfering with blood flow, there's a blockage. Well, that same blockage could be in your heart. And so when someone comes to me with that, that's the first thing we need to make sure of, is that we're not mistaking one thing for another, that this is a manifestation of actual heart disease. Even though you may not be having chest pain or anything, because it's not enough there, but there's enough there that is causing a problem. We need to also take a look at the heart too. So that's just the medical side that we need to make sure. That's why we like for you to get a medical checkup, just to make sure you're in reasonably good health. But then beyond that, now we can start talking about what we can do to help with blood flow. Now, you guys are both young. You're in your 30s, you're in your 40s, and so I know you have no problems whatsoever. Mr. Happy is just joyous and all is well in the house. But for guys that are older, it starts to change, and it usually starts to change around in their 50s. They start to notice. I mean, they can maybe still maintain, you know, they may need a little bit longer, you know, but they can get it done. And then when they get in their 60s, that's when often they have some difficulties. And so we do a lot of things, and I'm going to talk about some of the stuff that we do here. But I also want to speak to the younger brothers out there, because not only is this for people who are having a problem, it's also a way of preventing you from having a problem. Mm-hmm. Some of the things that we do that are non-invasive and not painful at all can really help maintain, so that you don't develop a problem when you get into your 50s and your 60s. Now, with you guys, you're working on the big muscles, you know, the abs, the biceps, triceps, and all that, and that's very, very important. My world is on that pubococcygeus muscle, you know, the PC muscle, as we call it, the sling muscle that's in the base of your pelvis, because that's the muscle that contracts when you have an orgasm. And the older you get, the weaker that muscle gets. And so as it starts to weaken, your ability to have a pleasurable orgasm starts to go down. Instead of this bang, bang, it's kind of like, and you're kind of like, okay, well, we got through it, you know, but it's not like it was before that, you know, that real intense. And that's that muscle. It's a sling-shaped muscle that's in the base of your pelvis, and that's the muscle that weakens. It weakens not only in men, but also in women, especially women who've had multiple pregnancies, or if they're very heavy, that muscle will start to weaken. So we have a device in my practice called the IMSILA chair that you can sit on, and it's totally painless. But what it does is it contracts that muscle. And you guys have probably heard of Kegel exercises. You know, women do that all the time. Men should be doing them too, but it's very difficult to really do that and maintain. When you sit on the IMSILA chair, in 28 minutes you'll do 16,000. Because this machine has a magnet in the bottom that causes the muscle to contract. It's not painful, it just kind of tingles a little bit, but what it's doing is it's tightening up that pubococcygeus muscle. So it's very helpful for increasing the strength of an orgasm. And also, you know, we've got a few guys that are, you know, kind of premature shooters out there, you know, where they can't hold it, they can't maintain, you know, the moment that they're sexually stimulated, they have an orgasm, they ejaculate. And again, that pubococcygeus muscle is at play there. And so by tightening up that muscle, it gives you more control. Because when guys are having sex, they want to have control. They don't want to just shoot off right then, right? And the pubococcygeus muscle is the muscle that contracts, and that's what helps with that. And so by tightening that muscle up, it's very helpful. So this is something that's an issue for guys that are way younger. You know, we're not talking about guys in their 60s and 70s. We've got guys in their 30s and in their 40s that are having problems with premature ejaculation. And so, you know, therapies like that would be helpful. Do you guys find that men talk to you about their sexual issues at all when they work out? Where do they, you know, see, women, we talk about
when they work out?
Yeah.
Yeah.
I mean, when they're just getting to know you.
Well, I would say certain guys, like the guys I'm close to, I mean, like my circle of guys. Now, we'll have that conversation. It's kind of like barbershops.
Right.
So we'll have that conversation, and, you know, we can help each other out.
Right.
And most of my guy friends, they kind of look to me for advice anyways, because I'm a trainer. So they're like, well, you're the trainer, so what should I do? I'm like, let me look it up. I had never heard of that one. Let me see about that. So but yeah, as far as like the guys go, but if it's somebody outside of that circle, no, you don't have a random guy like, man, I'm having trouble at home. Can you help me?
You know, they don't want to. And see, women will do that. We'll go to another woman that we know and we'll say, man, my man, he's just doing some stuff, and really, girl, sit down. I know exactly what you're talking about. I mean, we just connect that way. Men, because they're trained by society to be stoic, to have it all under control, they don't want to let down and show any type of potential weakness. And I'm not performing, I'm not doing what I'm supposed to do, that kind of thing. So they don't want to talk about it. But I think it's really, really important, and that's the reason for this podcast, because I want men to know that you can talk about anything, with somebody whom you trust, whether it's a physician or it's your trainer, somebody who is a professional that can be very helpful to you. Now, of course, when it comes to medical advice, you definitely want to talk to a physician because you want somebody who's trained in that. But just having a camaraderie, having somebody that you can talk to, that's part of the benefit, I think, of having a trainer. You create a friendship with that person.
Now, I've had some, one or two, guy clients that talk about taking those blue rhino pills. Sometimes, that part I never actually understood because I had these close friends tell me that they take it. And that part I never really understood. Why is he taking that? Is he not putting out, or does he want to put out more?
Exactly. Now, does anybody know what's in those blue rhino pills?
I don't know exactly what's in them, but I've heard people using them.
I hear about them all the time. There's a couple of them out there, and here's the deal.
It never made sense to me because I didn't know if there was, and because we're so stoic, right? I'm not gonna be the one to why are you? I'm thinking that you're doing it for a positive, so maybe they're doing it for a negative,
It's kind of like taking Viagra when you don't need to take Viagra.
Oh, a lot of guys do.
Yeah.
A lot of guys do.
Just to stay up longer.
Yeah, exactly. If I'm okay now, if I take the Viagra, man, I'm going to be a stud. And so it's the wrong mindset, and they end up getting in trouble because these are all medications. They all have potential side effects, and so you have to be really, really careful. But I think
Can you build a resistance against Viagra?
Well, you know what? I haven't heard so much of a resistance as the side effects. Guys don't like the side effects: runny nose, back pain. I mean, there are some things that go with that drug. And so after a while, they're like, you know what? It works, but I don't like all the side effects. You know what I mean? I don't really care for that. So that's why you just got to be really careful about that, because I know people are getting a lot of the Viagra, kind of on the side, just need to be under the care of a physician, because I have seen men have heart attacks on Viagra because, again, they were having problems and it was a blood flow issue, not only in their genitals but in their heart. And so they push the issue with the Viagra, and then they're having sex, and then all of a sudden they're having a heart attack. He's breathing fast, the blood pressure's up, and so, but with those supplements that you can buy in the gas station, you never know how well those are really, really working. I mean, if there's any scientific data behind them, I don't think so. But sex is 90% mental, and so once the physical part is overcome, then it's because you can be in great shape, able to perform, but then you look at a woman and you're just like, oh, no way. I'm so not interested in her. And there is nothing that will make you respond to her, right?
I've had a personal experience with that. My one past relationship was just a toxic relationship. I just grew out of sexual activity. It didn't matter what she did, how she did it, I just would not respond. You would not respond, right? And see, that's here. It's not your body, because your body was capable of responding. And I was just like, the relationship was not there.
It wasn't there.
And when it happened a few times, I actually called my sister, because she was a psychiatrist. I thought it was something mental. I thought it was crazy. And I was like, because that part never happened, right? Even no matter how bad the relationship got.
Right.
I was like, all right, something must be really going on with with us. And so I called her, and she was like, you're just probably not into it.
Yeah, you're not feeling it anymore. So you just have to just know that and just move on. Sex. The mental part of it is really, really critical. And I've had several couples that I've taken care of where they just don't like each other anymore. They have, when somebody did something, he cheated or she cheated, or somebody wrote a check they weren't supposed to write, or something, spent money, bought a car, went on a trip, something happened, and they're pissed. And they haven't worked that out. You know what I mean?
Yeah.
It's still an
Yeah.
issue,
Yeah.
so they can't respond sexually. They're just not in a position to, and they're like, you don't love me anymore. And it's like, well, no, I've been doing this and that joke you wrote last week, And so that's where, that psychological part plays a big, big role. But I want to talk about some of the things that I do in my practice, and I know you guys have probably never really, had a need for this because you're young, and but you should know about it because of your age. This may become something that you have an interest in. I mentioned before about blood flow and how with a penis, it's blood flow and it's nerves. The nerves are for sensation. I mean, because if you have good blood flow but you don't feel it, you're not going to respond, right? So you've got to have the sensation, meaning you've got to have nerves, and then you've got to have blood flow, because that's really all an erection is. That's all it is. It's just blood flow. It's just those large, you've got that big dorsal vein on the top of the penis, and it's just blood flowing down in there. It's tied to your brain because visual stimulation will cause you to have those blood vessels open up so that the blood can flow down there. So it's all kind of connected. So if there's a problem with flow, then even if you have the desire to be intimate with someone, if there's a blockage with flow, then you're going to either not get an erection or it's going to be a suboptimal erection. It's going to be not really quite hard enough to penetrate your partner. It's just kind of soft. Mm-hmm. And that can sometimes be even more frustrating because, you're so close. You're so close. You're like, just get a little harder. So that's where we do some things that are very helpful. The one thing we do is the male potency shot. And we do a similar type of shot for women. And I know anytime you start talking about a shot and you start talking about a penis, it's like those two things do not go together. It's like, way to know. But I do this quite a number of times, and the effect is really quite positive. Now, we've got a cucumber here because, we don't want to actually have an actual male penis, although we do have those that I use in my office for demonstrations. But what I do is draw some blood from my male patient in a special...
Penis?
No, we draw it right from the arm.
Oh, okay.
Good question. Although
it's through your veins and
oh my God, that takes me back to when I was working in the ER and I was up in Washington, D.C., and I had a patient who actually injected heroin in his penis through his vein. I mean, as soon as you said that, I'm like, oh my Lord, I remember that.
Veins? Why would you choose that?
Because that was the only one left. Okay, he'd been shooting everywhere else. I mean, he'd already shot his forehead up, all his arms, legs, everything.
Legs,
all of that. Gone. So he moved on to,
the last one.
Yeah, and you know how bad that is. I mean, the potential for an infection and potentially losing your penis from an infection. I mean, it's just because it's not like these people are using steroids. Mm-hmm. But anyway, we digress. So. I've got war stories you all wouldn't believe. You could make up some of the stuff I've seen. I mean, when I tell people, they're like, you're kidding. I'm like, no, I'm not. That's what life is stranger than fiction, and some of the things that you see in the ER. But we draw blood in a special tube, and then we put this tube that's filled with your blood into a special centrifuge that spins it at a certain speed, very, very fast. And what it's going to do is it's going to separate your red blood cells, which will be down at the bottom, from your plasma. And in the plasma, which is that yellowy fluid that's in the blood that you can't really see most of the time because the red cells are just so red you can't see the plasma. That's why we separate them. And in the plasma are the stem cells, the growth factors, all the things that your body uses to rejuvenate itself. So then we use a special long needle to extract those stem cells, and then we put them in a little syringe. The whole time that we're doing this, the penis is being numb. Okay, we have a cream that we put on here that is very good. I promise, it's very good.
Here it comes. Here comes the needle.
You're nervous. You say you look like you don't want to live.
I'm going to tell you, when I walk in that room with a syringe, these guys look at me like, Lord have mercy, what have I done? I think I'm okay without having any treatment. I think I'm all right. And I'm like, no, you're good. When we do it, then they realize there was nothing to it. But then what we do is that we literally inject their own stem cells and growth factors back into the penis in certain strategic locations. And this is yes, but you won't feel it. I swear, it's all numb. It's numb. I think the thing that freaks guys out the most is the fact that it is numb. And they're worried, like, is this gonna wear off?
Like, am I gonna really feel this?
Anytime soon.
Yeah, you know, it's
Yeah.
like they worry because it works so well until they're like, how long does this stay down like this? And I'm like, no, it'll wear off in about 30 minutes. And I'm like, okay, all right, because you know, I'm really kind of freaked out that I cannot feel my penis right now. And I'm like, I know, but you didn't want to feel it a few minutes ago. Trust me, when I was sticking the needles in there. But once we do that, the next step is to put him in what's called a penis pump. And I should have gotten one of those because they're really cool. This is a device that is a long chamber. Put the penis in there, and then we put it up against your body. We put some KY jelly so it's a nice tight seal. And then there's a little hand pump that's attached to it. So you gently pump it up to 10 millimeters of mercury. Now what that does is it creates a vacuum inside the pump. So it's pulling blood into the penis, okay? And your penis will get very big, very quick. I mean, it gets longer, it gets wider because it's gonna fill that chamber up. And you're gonna let it sit there for about 10 minutes. Now most of the time when guys do this, they're like, okay, now can I go home with this on? And it's like, no sir, you're gonna take this off. Because they're looking down at like this thing and then this big.
So I'm just a chamber.
You know, I've got people that just want the chamber, and you know, you go home with the chamber. That's all part of the procedure, and you use that for 10 minutes twice a day. And what it's going to do is the first thing the guys notice is their girth. The width of their penis gets bigger right off the bat. You know, ½ inch to an inch. You know, you'll see a width change as you use the chamber more. You'll start to see a little length grow, and you know, a ½ inch in some guys is really good news, you know what I mean? An inch, that's fabulous. And so this is the homework that one does after the procedure. Again, all of this is about stimulating the nerves and the blood vessels to make new blood vessels so that we're rejuvenating the penis, okay? And I'm glad you guys are here because you'll have people coming to you wanting to know about what can be done. And you don't have to know all of it, but just know that there are treatments out there. Now, after we get through that procedure in a few days, we'll have them come back and then we'll do something called shockwave therapy. And I know you did not like the name of that, but there's a rationale behind it. This is the shockwave device that we use here. And this device, when it's plugged up, I didn't bring the rest of the machine with me, but we literally go along the shaft of the penis with this device. We lube it up so it's nice and slippery, and then we go up and down, back and forth like this. And what this does is there's a shot put in here. And so it goes boom, 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 boom. So you literally just feel pressure. That's all. It's not painful at all. You just feel. And why do we do that? What's the reason? The rationale is that when you hit the soft tissue of the penis with this thing, because it's like a sound wave almost going through, it's going to cause little tiny micro injuries inside. And anytime you have an injury, you got to heal. Right? Exactly. So you start making new blood vessels, new nerves. And so it's almost like a way of kind of going around the blockages. And so in addition to trying to get the blockages open, and we have some supplements that we use to do that. I'll tell you about that in a second. But this is a way of actually causing like little detours around blockages. And so we do this on a regular basis as well. So there's a lot of really, really great ways to help guys. The other is with some supplements that I have. One is Arterosil. This is a supplement that literally cleans out the blood vessels. I give this to people that have heart disease as well as erectile dysfunction because it helps clean the blood vessels out. I have another supplement called Vascanox, which dilates the blood vessels. So if you're having a problem with flow, by dilating it, now you're overcoming some of that. So all of those together, they kind of all work together to really help. To get guys where they're feeling, you know, like, okay, I can do this, I can do this. And then
Unstoppable treatment.
Yes, exactly. Well, you know, it's
unstoppable,
and it gives guys something that they haven't had in a long time. You know, because I see the difference when I do this on guys, and I just see their swagger. You know, they feel more confident about themselves. You know, and that guys tell me, look, they pull their pants down, look, and I'm like. Okay, listen. I got you. You know how many things I'm saying? Trust me, this is not news for me, but I'm happy for you. A lot of guys will notice, especially sitting on that Emsula chair, that their scrotum, the scrotal sac goes up. Because as men get older, it kind of starts to drag, kind of hangs, you know, and it's just there. And it's because of that pupil coccygis muscle that's tightening up, and they'll notice that their scrotum starts to go up, and they're like, man, this thing is sitting up here like it did when I was in my 20s, you know? That makes them feel so much better. And so there's a lot of good news. And I know, you know, people can giggle and laugh about this, but when it's your penis, it's not working, it's not funny. And that's the reason why, you know, I do this, because I know that when men feel good, you know, just from my perspective as a physician and as a Christian, you know, the male is the head of the house, and he's supposed to be happy and able to perform. And when he can do that, then he can spread that joy all throughout the house.
Yeah.
You know, it flows all the way across. And you know, I know that expression, when mama ain't happy, daddy ain't happy, nobody's happy, and that's true too. But there's also the importance of him being happy. And there's some things that the wife just can't fix, you know, she just can't fix it. So that's where we can fix it if you come and see me and understand that this is something that's completely confidential. Nobody's broadcasting this. I've taken care of many, many people, and you know, it's just about helping you to get your swagger back, to get your groove back. You know, if you feel like you're kind of going down a little bit, let's see if we can bring you back up. Now, the last thing I want to talk about are hormones, and I know that with weightlifting, testosterone levels go up. And that's a good thing. Do you guys do it for that reason? Do you talk to your clients about testosterone?
No, I don't. I usually just tell them, most people just want to look good naked. That's like their main goal.
Yeah.
So, like for me, that's like my goal. I want to, like heart disease runs in my family too. So that's kind of more the reason why I lift on the daily basis that I live. But other than that, I just want to look good naked. Like I want to be able to walk out, take my shirt off, and feel confident. You know what I'm saying? I want to have nice legs and wear short shorts and stuff like that. I'm saying, excuse me, when I walk into the gym, you know what I'm saying, I want to feel like, you know what I mean? I want to be like, you know what I'm saying, I might not be the biggest guy in there, but I want to feel like, you know what I'm saying, everybody look at me like, okay, I see you, you know what I'm saying? That's how I want to feel. So for me, that's why I lift weights.
What about you?
You know, I may sound like a broken record, but when it comes to kind of managing your testosterone, it's going to be starting with that diet first. I try not to mess too much with like, you know, hormone therapy or testosterone or anything first, because I'm a natural bodybuilder. And so any kind of HRT or anything like that is kind of like frowned upon, and you can't do it, even if your testosterone is low. But the fact that you're doing it, then you're not a natural competitor. And so I always refer. Like, okay, let me refer you to another personal trainer.
That's right. With you doing professional weightlifting and you're like going to competition and things like that, so you can't do any kind of substance.
Yeah, it all has to be natural. So that's why I refer back to the diet. So hey, here's a diet that can help with your hormones and stuff like that too. Even for my ladies, here are things that can help with while you're on your period and stuff like that. But for the guys, here's what you can eat to help with your testosterone levels. You know, as a competitor for guys, your test is going lower anyway because you're just constantly pounding.
What do you eat to raise your testosterone level?
I mean, for guys, it's gonna be veggies. There are some supplements out there, natural supplements out there that you can use. And then honestly, most of the time, I'm taking like a good off season. Not going as hard. That's because when you're in prep, you have a lot of body manipulating that's happening, and so it's not. I'm not exercising this year, but it's not healthy to do more than one or two bodybuilding shows a year. And so one bodybuilding show a year is kind of like.
Because you really concentrate on getting yourself ready for that.
Yeah, and then this year I'm kind of doing like 9 shows, and so this is like.
Well, how have you done these shows? How have you
and so I'm a world champion bodybuilder. I got my world champion title.
You should have led with that. We got a world champion here. Oh my gosh.
And so I got my world championship title in 2022. And I've done well since then. I've been a professional bodybuilder since I started. I got my pro card, my first show. And so this year, it started a little rocket. I started pretty early this year, and so I've been placing it at my last 2 shows. And so out in Florida, and so I'll bring it back to Texas the next 2 shows.
Oh my goodness! Well, that is awesome. Congratulations! I didn't know we were sitting here in the presence of a world champion. Oh my goodness! That is fabulous. Well, with the hormone replacement that I do in my practice, we do what's called bioidentical hormones. Because I have a real aversion to synthetics. And when guys go to those low T places, where they get the shots, that's all testosterone cyprinate, and it's a synthetic testosterone. And there's a reason why there's a synthetic product out there, just like synthetic estrogens, because the pharmaceutical companies can't get a patent on something God made. So the only way they can get a patent and get in that game is to create something slightly different. And the problem is that when they give you that product, your body's never seen that before, okay? So what's going to happen is a little bit unpredictable. And unfortunately, bioidentical hormones have gotten a bad rap because they've been lumped in with synthetic hormones. And when you do something that's bioidentical, that means that it looks exactly the same as the hormones that your body made when you were younger. They literally make it that way, so that when you look at it under a microscope, you can't tell the difference. They look the same. So if it were going to hurt you, then what you've been making all your life would hurt you, because you can't tell the difference. They're the same. And that's the reason why I do that. I do not do synthetics at all, only natural. And I know with what you're doing, you can't do it. But my goal is to sort of turn back the clock a little bit and to sort of get you in a place where you feel better. You have more energy. When I can get your testosterone level up, you can lose weight easier. You sleep better, your sex drive is better, you're not as angry and pissed off at the world, your memory's better. So there's a lot of really great benefits, to it. And so that's the reason why we do pellets. And in particular, the testosterone, and for some women, estrogen pellets too, that we do. For guys, their pellets last them for 6 months. Once we put the pellets under their skin, on their little backside, we do the same thing for women. Guys, their testosterone level will stay up for 6 months. Now, when you do those shots, you got to go in about every 2 weeks, and you got to get a shot. So you feel good for a few days after the shot, and then you start not feeling so good. This time you get another shot. You feel good for a few days, and then you start. So you're on this roller coaster. And I have quite a number of male patients getting the pellets now that tell me, they used to get the shot, and they're just like, oh God, please tell anybody that's out there getting them shots, don't do that. Come in here and get this. You're good for 6 months, It's like, why would you go there and keep getting these shots over and over and over again? And it's synthetic,
So these are pellets is on the natural side.
Yes, I think so. Yeah, I think so.
So is it still considered HRT?
Yes, it is, because that is simply hormone replacement therapy. Yeah. And it's true hormone replacement therapy. In my mind, it's more hormone replacement therapy than the synthetics. Yeah. Because you're literally replacing their hormone. Yeah. You're giving them the exact same thing their body used to make. There's no difference. And so when they measure your testosterone level, it's going to go up. I mean, I've got guys with testosterone levels in the low 200s. And they are practically crying in my office because their levels are so low. They're sad, they're weepy, they don't feel good, they're pudgy, they just, I mean, they can barely come in the office. It's usually the wife that's in there just, don't come back here, because she can't live with them anymore. We put the pellets in, wait about 4 weeks, have him come back. I already know he's better by the way he's walking in. He's happy. And then when we draw the blood and we measure the levels, we see, oh yeah, you're good now. You 900, 1,000, you're good. And you can tell the difference. One lady said, oh my God, my husband's been mowing the lawn almost every day. He won't stop mowing the lawn. I couldn't get that man off the sofa. Okay, now he's having to just, because he feels good. And so that's the reason, for doing it. Because again, that raises her stock with him. Now he's feeling more like the dude, like the man, So it just makes everything in Homeville better, because he's got to do his thing. I'm somewhat of a traditional person, and I know that. I know there's women out there that are not of that mind, and they're just like, I'm this and I'm that. Listen, I'm this and I'm that too. But when it comes to being in a relationship, a healthy one, especially if you're married, you've really got to honor the male. He's got to honor you too. Don't get me wrong. I'm not taking anything away from his responsibility to honor you, and that's very clearly spelled out in the Bible. But I do feel that you've got to honor him and take care of him so that he can take care of you. And I have a lot of my female patients that are ticked off that their husbands aren't doing for them, but I'm like, what are you doing for him? You got to take care of him so that he can then take care of you. Now, if you're doing everything and he's not, well, that's another story. That's another podcast. We can talk about that later. But overall, this is what we do here, and this is what these gentlemen do. You know, they help people get their bodies in a place where they can feel good about themselves. And I think that's so critical. People often come to doctors for wanting to get control over their weight, get control over their health problems. And unfortunately, most doctors, I literally have patients tell me this, when you go in to see certain doctors, they will literally print off a diet off the internet, you know, and hand it to them and say, okay, you need to follow this diet and you'll be fine. And it's like, no. I mean, no question about their lifestyle, about who they are as human beings, what they want out of life, what their relationships are, what their stresses are, what's bothering you, what do you need. And I believe in partnerships with people that do things better than I do, you know. I got the medicine down cold, but then I'm not a trainer, you know, and I can talk to people about exercise, but I don't know it the way you guys know it, you know. My exercise advice is really more to get started with walking, just because anybody can do that. And it gets your metabolism going, it gets your endurance up, you know, you can kind of keep going. And then, you know, you can look into doing more things. Because I think sometimes if you try to hit people too hard, too fast, they get overwhelmed and they run away. And so you're better to just let them start, you know. So we're getting ready to close because this has gone way longer than it probably should have, but I just enjoy, you know, hearing things from different perspectives. But let's say you've got a guy coming in and he's like 53, 54 years old, and he weighs like 275 pounds, and he's like maybe 5'11", 6 feet, you know. He's been told he's got high blood pressure. He's been told his cholesterol is 250, you know, the doctor wants to put him on some medicine. His sugar's up a little bit. You know, his granny had diabetes and had her legs cut off, and now they're saying, you know, that he's you know, looking a little funny about that too. And, you know, the doctor's worried. He's saying, you know, you need to do something. And I know this great trainer that I want to send you to, okay? And I mean, there's two of them, they're real good. This dude named Callie, this dude named Laz. I want you to make an appointment, and I want you to meet with one of these two dudes, and I want you to get yourself right. I can't do it, but I think they can help you. So he walks in the door. Hey, my name's Cindy. Doctor told me I need to come in here, I need to talk to y'all. What are you going to say? What are you going to do? I'm giving you both a chance to tell me what you would do.
First, I'm going to welcome him. I'm going to introduce him to the gym, make him feel like he's part of the family, feel like he's at home. From there, I'm taking him to the scale so I can see. I want to see where we starting off at.
Right.
Because where you start off from, you know what I'm saying, it's not where you're going to finish at. So we need to know where our starting point is.
Yeah.
Then we go through a questionnaire. I want to see, you know, I want to know, you know, your past. I need to know you. I want to get to know you for you. I want to know what you eat, what you don't eat, stuff like that. From there, that's when I kind of take them into a workout. Something I want to see what you can and can't do. I want to see what you're capable of, what your strengths are, what your weaknesses are. Nothing you do is right or wrong in my eyes. I just want to see what you can do. And then from there, now we can have a conversation. We're conversating about what your goals are, and then I'm telling you how I can help you to get to your goals. As I'm helping you, as I'm talking to you, I'm showing you some little things just to kind of hook you in.
Yeah.
To kind of be like, okay, he know what he's talking about, or he know what he's doing.
Right.
Once we get down, we figure out a plan as far as this best schedule for you, what program fits your schedule, what fits your budget. Then we can go down and I can sit down and actually write out a workout plan for you. I can sit down and make a meal plan for you. You know what I'm saying? I don't like to call it a meal plan because I like my clients to eat balanced meals because a lot of people don't eat enough meals. That's why they skip breakfast, or they'll eat breakfast and lunch and skip dinner, or they'll eat, you know, 2 out of 3 meals, or maybe just eat 1 out of 3 meals. So I got to figure out what you skipping, what you're missing out on. So now it's to get you to start putting those little things back in to your diet. Like everything, like I tell everybody, everything you did when you was a child, think about it, when you was a child, you ate 5 meals, probably 3+ meals for sure. Because you was outside, you was active, you was playing, riding bikes, all that stuff. Let's go back to that childhood. Let's do everything we was doing when we was a child, when we had the best energy of our life, when we was feeling the best of our lives and stuff. So basically, you just kind of got to revert back to kind of like old habits, I want to say, as far as what we was doing as a child. First, got to eat. That's number one thing. Okay, now we got that down. Now we got to figure out what we need to take out of the things we're eating.
Yeah.
Then we gotta get active. Okay, we got that down. Now let's see where we at. Let's get an assessment. Let's get on the scale. Let's see where we at. Let's see where we at from where we started last month to where we at this month. If the numbers are moving, hey, we're doing great.
Yeah.
Let's stay right here. If the numbers aren't moving as fast as we want them to, then we need to figure out what we're missing, what we done back in there. So kind of let's revert back. Are we eating our meals? Okay, we eat our meals. Okay, so it's not it. So that means it's on me. It's the workout part.
Right.
I need to turn it up a notch for the workout.
So
you can
and that's
see
what you're
the
customizing it, you know, to the patient and to their metabolism, because two different people doing the same routine are going to get two different results.
Exactly.
You know?
I mean, everybody's different. Everybody's body is different,
Right.
and how they react to certain things are different. So it's kind of like, let's try this, see if it works. Okay, it's not working. Let's try this.
Yeah.
Now within there, you're gonna gain strength. Within there, you're gonna learn how to eat. You're gonna learn how to grocery shop. You're gonna learn how to save money. You know what I mean? Those are key things that you need to go throughout your journey.
Now, well, how do you guys feel about all of these online apps for, you know, losing weight or for working out? Because I mean, there are a lot of them out there now. You know, for like $30, you can get a 3-month
Honestly,
subscription.
with the online apps, it all boils down to action. There's you can YouTube on how to get healthy, but nobody wants to actually put the work in and put the action in.
Do you feel like coming to someone like you creates more accountability? So that when you have a connection with someone, because you know, if you're just doing your own app on your own and you decide today we're not doing it, nobody says anything.
Yeah, and that's the thing. I think the apps is it's a great tool, maybe like to jumpstart, right?
Yeah.
And so, but you're still gonna need at some point some accountability. And so one thing that I tell anyone when they first come in is check up from the neck up.
Yeah.
Like, let's go step on the scale first, and what we like he was saying, we need to see where we're at to know where we need to get to. And so the apps is just, you know, it's just kind of like a bridge.
Yes,
So,
yes.
once you get past that, and then there's some people they're not comfortable with the gym, so that's why we do have that. As soon as you get to the gym and you're here for a reason, bringing the gym alive, introduce you to the staff. That's something different than the big box gyms where they're just trying to worry about first swiping and checking you in.
When I hear those places are like hookup spots too, you know, people are walking around and they're half naked trying to pick up somebody. And it's like, you know, for those who are like not really feeling that, you know, they're embarrassed, you know, because they feel like everybody's checking them out like for a hookup. And it's not, people are walking in there that are really worried and they're trying to do something, and so that's not the right environment.
Yeah, like I've had clients before come in and be like, I don't like doing crowds, or I don't like this. And I tell them, I say, everybody in here in the gym has started off at the bottom. Everybody came in just like you, not knowing what to do, scared, you know, a little bit apprehensive about certain things, but then once they come in, and it's up to me really to calm them down and help them relax. And once they do that, then it's like, okay. Then you look up a week later, they come in on their own and hey, where's Callie at? Ready to get started, you know what I'm saying?
And that's a good thing. That is such a good thing. Well, you know, the one thing that I got from just talking with you guys, and I hope that the audience got too, is that creating a healthy, compassionate relationship with a trainer can make all the difference in the world. You know, there's a lot of do-it-yourself stuff in the world these days. You know, everything is tied to our phone and our apps. But there's some things that are so personal and require such a commitment that creating a relationship with somebody who's good at what they do can really take you further down the road than trying to do it yourself. Because it's sort of like, you know what, if you could have done it, you'd have already done it by now, right? So, you know, just giving somebody $30 on an app, you know, how is that, what's different? You know, you're still the same person. You don't have any new relationships with anybody that's really going to help you.
See, the thing is, I don't like about apps is that same app you bought, right? I bought that app, he bought that app. It's the same program.
The same program.
It's a cookie cutter program.
Right.
So how are we going to distinguish the differences of what I need to do compared to what you need to do by using the same app?
Right. No, it's, you know, I have concerns, and I'm not against apps. You know, please don't write me if you have an app. I'm sure there have been lots of people that have been very successful with them. But I just know, just looking at my practice and the patients that I've taken care of, that even when it comes to the weight loss that I do with them or the hormones that I do with them, it's the relationship that I have with them that really drives their success. And so I want the same when it comes to this. Because I think at the end of the day, if you really want to have complete control over your health and your weight, you need to have a way of eating. I don't want to call it a diet because that somehow there's something negative about that, but it's a way of eating that lines up with your metabolism and an exercise regimen that makes sense for you. And everybody's different as to what that is. And I think that's when the trainer really comes in to help you figure out what it is. Because some people may need to lift more weights than another person in order to achieve the outcome that they're looking for. But you don't know what that is. As a layperson, you don't know. But a trainer can help you to know that. So again, tell me where you guys are located. You're at Space City?
Space City out in Humble, at Dibberg Mall, just outside of Dibberg Mall.
Okay.
59 and 1960.
Okay, all right.
1960 area.
Yeah, for those that are looking for a trainer, I mean, listen, I'm always looking to hook people up with good advice, with good people, and I think that these guys will be very helpful. And if you are someone who has never had your hormones measured, you need to come see me because we need to know where you're at, and we can certainly help you if you're sitting there crying, feeling sad, where you don't even have enough juice to go to a trainer. We can get you up, get you going, and make you feel so much better. Thank you so much, you guys, for being on the show. I appreciate it. I'm so excited. You gotta let me know next time you're in a competition so we can be rooting for you.
Definitely.
And thank you guys for watching, and we will see you next time. Bye.